I'll be performing a simple wound dressing. Disinfect the trolley with antibacterial wipes and allow to dry. Perform hand hygiene and gather necessary equipment. Prepare the patient and environment by placing a waste bag close by within reach. Also position a waterproof sheet under the affected limb to protect the bed linen. Use personal protective equipment as necessary. In this instance, I am only using non-sterile gloves as I don't expect any splash injuries. Remove the secondary dressing. See how I am doing it slowly and carefully? Use counter traction by holding the skin taut when peeling off the micropore tape. If you don't do this, ripping the tape off may tear fragile skin, especially in the elderly. Assess the exudate on the secondary dressing for type, amount, and odor. Remove your gloves, discard, and perform hand hygiene again. When using Elcogel, apply a generous amount to ensure that the product is sufficient to cover every part of the hand and rub for 20 to 30 seconds till your hands are dry. Then you're good to go. Now we can establish our aseptic field. Open the sterile dressing pack by only touching the corners and by going around the trolley. Using minimal touch, pick up the yellow forceps and organize the rest of the equipment. (2.5 to 5 centimeters of the aseptic field is considered contaminated. Never reach into the aseptic field which is past this border. Notice that I have put the handles of the forceps at the edge of the plastic sheet. This is because I will be holding the forceps with my hands later, thus contaminating the handles. Key parts are critical parts of the equipment that, if contaminated, are most likely to cause infection. The key parts of the forceps, that are the tips, will be coming in contact with the patient's wound, which is the key site, and therefore has to be aseptic. Open the packs of combine and non-adhering dressing away from the aseptic field and flip onto the trolley. The combine is the secondary dressing and the non-adhering dressing is the primary dressing. When pouring the normal saline into the green receptacle, try not to splash all over so as not to wet your new dressings. You just have to aim it right. Prepare the gauze as I'm showing and make sure that it is not dripping wet. Tease it out and leave it in the receptacle. You need to keep some of the gauze to dry the wound. You can add more gauze if necessary, as it depends on the size of the wound and number of gauze needed to thoroughly clean the wound. You may obtain this information from the patient's wound management plan. Okay, we are now ready to start. Use the yellow forceps and remove the primary dressing. And note the exudate on the dressing and assess the wound and its surrounding skin. This is also known as the key site according to ANTT principles. Extend the aseptic field with the drape, being careful not to contaminate the forceps by touching the patient or the surroundings. Make sure that the drape does not touch the trolley as well. The reason for this extension is merely if you drop a sterile object onto it, it is not contaminated. Think of it as an extra playing field. Using an aseptic non-touch technique, swab the wound from the clean area to the dirtier area. In this opened wound, which is also known as the key site, clean from the center working towards the outside. Use each swab once only. Notice that the contaminated forceps never goes into the aseptic field. The aseptic forceps picks up the gauze and is passed to the contaminated forceps. Clean the outside of the wound, that is the surrounding skin. If it's a surgical incision line, start over the incision line and swab from top to bottom. Discard the swab and proceed again on either side of the wound. Dry the surrounding skin and apply non-adhering dressing and the preferred secondary dressing. And in this instance, it is a combine. Secure the dressing with tape. You may use a light bandage or tubey net or tubey grip to keep the dressing in place. This all depends on the fragility of the skin. Dispose of equipment appropriately, perform hand hygiene, and don't forget to document your wound assessment in the wound management plan and progress notes. Thank you.